Assalamu alaikum, this is Jahangir and you are watching Medical and Nursing Lectures. Dear learners, today we are going to present you some MCQs related to fundamental of nursing. So please subscribe our channel and press the bell icon. Dash is a heart rate in excess of 100 beats per minute in an adult. So here the options are tachycardia, bradypnea, tachypnea, dysrhythmia, and the last option is bradycardia. So as we know that the normal heart rate is ranges from 60 to 100 beats per minute. So here they are saying that if the heart rate is above the 100 beats per minute, so what term we will use for that? So here the correct option is tachycardia. Skin covers dash areas of the body, which includes heels, ankles, hips, and tailbones. The options are peripheral, bony, epidermis, inner, and dermis. So here they are talking about the organs which they are bony areas. So skin covers all these bony areas. So here the correct option is bony. Which of the following is the originator of the message? Channel, sender, receiver, decoding, and message. So as we know that a sender is a person who generate a message. So here the correct option is option B. Which of the following would be the most appropriate choice to use measure the temperature of a client who has a history of heart disease and has eaten a bowl of vegetable soup 45 minutes ago? Here the options are rectal, oral, tympanic, axilla, and popliteal. So here the correct option is axilla. Which of the following is the normal degree of temperature? Option A 37 degrees Celsius, option B 38.5 degrees Celsius, option C 35.5 degrees Celsius, option D 37 degrees Celsius, and the last option is 36 degrees Celsius. So here the correct option is 37 degrees Celsius. Failure to listen is the improperly decoding intended message or the best example of communication, therapeutic communication, non-therapeutic communication, methods of communication, barriers of communication. So the correct option is barrier of communication, because when we do not properly decode a message, so we will count that in a barrier of communication. Which of the following role that the nurse conveys proper information while shifting a patient? Teacher, counselor, communicator, advocate, collaborator. So here the correct option is communicator, because the person who is going to hand over the patient to another staff, he will communicate all those things related to the patient, whether they are lab reports, whether that is patient history, or anything else. So here the correct option is communicator. Which of the following is a skilled practitioner? Option A is professionalism, B occupation, option C professional, option D professionalization, E profession. So here the correct option is professional, because a professional is a person who have the knowledge about their own skills and they have the skills also. So here the correct option is option C professional. Which phase of oxygenation involves actual gas exchange between atmospheric air and alveoli and blood capillaries? Ventilation, exhaling, respiration, breathing, perfusion. So here the correct option is respiration, because respiration is a complete process in which the gaseous exchange occur between the alveoli and blood capillaries. Although there are some the respiration have many phases, but in other phases the gaseous exchange do not occur between the alveoli and the capillaries. So here the correct option would be respiration. Which of the following that the systolic pressure less than 90 mmHg or 20 to 30 mmHg below the client's normal pressure. That is known as respiration. Direct, hypertension, and indirect. So you can guess that the correct option would be hypertension. Which one is the first step once the hazard has been identified to be implemented to control the hazard? Ignore the hazard, consider reducing the hazard to an acceptable level, select and provide an appropriate personal protective equipments for the employee, leave the hazard, consider eliminating the hazard if possible. So here the correct option is option C. Select and provide inappropriate personal protective equipments for the employee, because the hospital environment is full of hazards. So we can control all the hazards by wearing or by applying personal protective equipments, in which there is your head cap, your goggles, your face mask, gloves, and all these things. Which of the following is known as the father of medicine? Bubonic plague, Hippocrates, ancient Romans, Hebrew, Crusades. So here the correct option is option B, Hippocrates. They are known or the father of medicine. The nurse assists the client learning needs, readiness to learn and help to learn their healthcare procedures is best related to teacher, advocate, counselor, communicator, collaborator. So here if the client have some learning needs, so the nurse will play the role of a teacher. Here the correct option is option A. A nurse is evaluating and evaluating patient balance. Which factor would the patient is most important for the nurse to assess? Respiratory rate, energy level, posture, strength, and shortness of breath. Here the correct option is patient posture, in which posture the patient is sitting, the patient is standing. So by that he will assess the patient that whether the patient can be ambulate or not. I mean the patient can be moved from one area to other or not. Which of the following intervention would you do to promote among patients to improve proper breathing? Provide little information to promote anxiety, take fast, shallow breathing, limiting inhalation, inhale slow, deep breaths, limit fluid intake. Here the correct option is inhale slow, deep breaths. While teaching the clients, you must have to tell them that inhale slow and deep breaths. So this is one of the method to promote the proper breathing among the patients. Which is important to consult during nursing intervention when Braden score is less than or equal to 18? Physiotherapist, dermatologist, physician, cardiologist, and nutritionist. So the correct option is nutritionist. Score of 13 to 14 in Braden's scale for bedsore is used to categorize the following risk: no risk, moderate, high risk, mild risk, very high risk. So the score of 13 to 14 is considered a moderate risk. The correct option is moderate. The nurse helped the client to recognize and cope with stressful, psychological, or social problems are the best example of collaborator, advocate, counselor, caregiver, and manager. Here the correct option is counselor. Which of the following is the originator of the message? Decoding, receiver, message, sender, channel. I think this one is the repetition of the old one question. So here the correct option is sender. Which clinical feature result in shortness of breath after a period of sleeping with sitting upright position resolving the symptoms? Select one. Paroxysmal nocturnal dyspnea, platypnea, tachypnea, orthopnea एंड ब्रैडिप्निया. यह आपसे ये पूछ रही है कि जब एक पेशेंट स्लीप कर रहा होता है, वो सो रहा होता है, तो थोड़ी देर बाद जो है उस पेशेंट को शॉर्टनेस ऑफ ब्रेथ जो है वो डेवलप हो जाता है. तो नीचे दी गई कौन सा ऐसा ऑप्शन है जो कि इस पेशेंट के लिए हम मुंतखब कर सकते हैं, वो करेक्ट हो सकता है. और ये जो पेशेंट है जब उठ जाता है या जो है ये सिटिंग पोजीशन में आ जाता है, तो इसका ये जो कंडीशन है वो सही हो जाता है. जो शॉर्टनेस ऑफ ब्रेथ है ये सही हो जाती है. तो द करेक्ट ऑप्शन इज़ पैरोक्सिस्मल नॉक्टर्नल डिस्निया, यानी कि नॉक्टर्नल का मतलब है नाइट स्लीप के दौरान और डिस्निया का मतलब है डिफ़िकल्टी इन ब्रीथ. पैरोक्सिस्म का मतलब है कि बार बार आना. Delegation, organization, teamwork, leadership and mentoring are the best example of. Select one. Collaboration, credibility, non-verbal communication, coordination, compassion. Here the correct option is coordination. A patient is restrained at the wrist. At intervals, she is flexing her arms, pulling against the restraint tied to the bed. What type of exercise is this? Aerobic, anaerobic, tonic-clonic, isotonic, isometric. So if a patient is being tied from his wrist, so there will be contraction in their muscles, but there will not be any kind of movement. So here the correct option is isometric, because in isometric exercise the contraction occur in the muscle, but there will be no movement in the muscles. The nurse assists the client learning needs, readiness to learn and help to learn their healthcare procedures is best related to teacher, counselor, collaborator, communicator and advocate. So here the correct option is a teacher. Which is the best answer? The thermometer requires to be shaken down. Digital, electronic, scan, tympanic. So all of these are kind of temperature which we do not shake at all. The options E, glass thermometer, or which we say mercury thermometer. This is the only one thermometer which we people shake down to reduce the mercury level of this thermometer. Correct option is E, glass. Which clinical features has an oxygen supply of 75 mmHg in blood and results in a bluish or dusky skin discoloration involving mouth, lips and nails bed? Sinuses, dyspnea, hypoxemia, bradypnea and tachypnea. So here they are asking about the reduction of oxygen level in the blood, right? So if they're talking about the reduction of the oxygen level inside the blood, so here the correct option would be the hypoxemia. Which of the following is the priority of nursing care? One-to-one care, hazard, safety, mints, timeliness. So here the correct option is safety, because when we will have a patient, so this is our first responsibility to provide safety to the patient, whether we are providing care to the patient, whether we are providing medication or something else. So the first thing which we should provide to the patient is the safety of patient. Which of the following is the first deaconess and visiting nurse? Romans, Florence Nightingale, Dorothea Dix, Hebrew and Poibi. Here the correct option is Poibi. Poibi was the first deaconess and also the first visiting nurse. A patient has a pulse rate of 104, respiratory rate of 24, a blood pressure of 138 by 90 mmHg, and a temperature of 102.8 Fahrenheit, is a nurse which will you assess first? Temperature, respiration, height and weight, pulse. Here the correct option is temperature, because when you will reduce the temperature of the patient, so the pulse rate and respiratory rate will automatically come down. A patient who is observed with 18 inspirations and 18 expirations, what is the respiratory rate? 36, 20, 12, 18 and 22. Here the correct option is 18, because each respiration have one inhalation and one exhalation. The correct option is 18. If a patient CO2 level is 55 mmHg in blood and has confusion and disorientation episodes, they most likely have which of the following? Dyspnea, sinuses, hypercapnia, hypoxemia and hypocapnia. So here the correct option is hypercapnia, because the normal level of CO2 in the blood is 35 mmHg to 45 mmHg. If this level exceeds from its normal, so we will term this hypercapnia. Which of the following could put the nurse at risk for sustaining a back injury? Raising the bed to waist level to change patient's position, placing the feet apart before sliding patient up in bed, lifting a box of IV supplies up and over the head to place on the shelf, raising the bed to waist level and starting IV, squatting to measure chest tube drainage. The correct option is option B, placing the feet apart before sliding patients up in bed. Uses gestures, facial expressions, touch and other forms are the best examples of verbal communication, non-verbal communication, therapeutic communication. So we have been studied that the non-verbal communication is a wordless communication. So gestures, facial expressions and touch is the non-verbal communication. There is no usage of any word. So here the correct option would be option B, non-verbal communication. This is a potential source of harm. One-to-one care, timeliness, safety, hazard. So here the correct option is hazard. Hazard is a potential source of harm. Which of the following is not part of Braden scale for bed sores? Mobility, moisture, inactivity, friction, shear, and cognitive perceptual. So here the correct option is inactivity. Mobility, moisture, friction, shear, cognitive perceptual, all these are involved in the Braden scale for bed sore. Which word is most closely associated with nursing care strategies to maintain functional alignment when patients are bedbound? Strength, endurance, balance, tolerance, and support. So here the correct option is support. Dash may be in the form of words, pictures, or signs. Encoding, receiver, message, sender, and decoding. So here the correct option is message. Is we have been studied that the message can be in the form of words, pictures, or in the form of signs. Which is a process in which the nurse consciously influences or helps the client to a better understanding through verbal or non-verbal communication, that is known as verbal communication, methods of communication, non-therapeutic communication, therapeutic communication. So here the correct option is therapeutic communication, in which the nurse consciously help the client to a better understanding. through verbal or non-verbal communication. A patient with impaired mobility is being discharged within a week from the hospital, which is an example of a discharge goal for the patient. The patient will ask questions regarding movement and mobility. The patient will be kept clean and dry at all times. The patient will understand range of motion exercises. The patient will transfer independently to a chair by discharge. The patient will be taught range of motion exercises after they are ordered. So here the correct option is option D. The patient will transfer independently to a chair by discharge. The founder of modern nursing is considered to be Florence Nightingale, Romans, Dorothea Dix, Dorothea Orem. The correct option is Florence Nightingale. Exposure to blood, insects, fungi, and plants can cause which of the following hazard? Physical, microbial, chemical, biological, microbial, and biological. As you know that there are a lot of types of hazard. So here the correct option would be option D, biological or microbial, because they are talking about both the things, blood, insects, fungi, and plants. So they are also can be considered as biological and as well as microbial, because they are also talking about the blood, insects, fungi, and also talking about the plants. The correct option would be option D, biological and microbial. Subscribe our YouTube channel Medical and Nursing Lectures. Please like and share the video. In case of any query, leave a comment.